Hello and welcome, dear viewers. Today, we're talking about a very important topic that affects millions of women around the world: breast cancer. It is one of the most common types of cancer in women, and early awareness can truly save lives. In this video, we'll discuss the causes, symptoms, treatment options, and most importantly, how to detect it early and protect yourself. So please watch this video till the end. Your health, or the health of someone you love, may depend on this knowledge. Asterisk, asterisk. Breast cancer in women, a complete medical overview. Definition: breast cancer is a malignant neoplasm that arises from the uncontrolled proliferation of epithelial cells in the ducts or lobules of the breast tissue. It is the most common cancer among women worldwide, and early detection dramatically improves outcomes. Epidemiology: over 2.3 million new cases are diagnosed globally each year. WHO 2023. It is the leading cause of cancer-related death among women aged 35 to 55. With early diagnosis and proper treatment, 5-year survival rates can exceed 90%. Risk factors: hormonal, genetic, lifestyle, other. Early menarche less than 12 years. BRCA1, BRCA2 gene mutations, obesity. High BMI age greater than 50. Late menopause greater than 55 years. Family history: mother, sister, alcohol consumption, previous radiation exposure. Nulliparity or late. Childbirth, Li-Fraumeni syndrome, sedentary. Lifestyle, hormone replacement therapy, HRT. Pathophysiology: breast cancer typically begins when genetic mutations disrupts the normal regulation of cell growth and apoptosis in mammary epithelial cells. These mutated cells multiply uncontrollably, forming a primary tumor. If left untreated, the cancer can spread, metastasize through the lymphatic system or bloodstream to distant organs such as the lungs, bones, liver, or brain. Clinical signs and symptoms: a hard, painless lump in the breast. Nipple discharge, especially bloody. Inversion or retraction of the nipple. Skin changes, dimpling, thickening, or orange peel texture. Swollen lymph nodes in the axilla armpit. Asymmetry between the breasts. Breast cancer in women. Full medical explanation of causes. Etiology: breast cancer is a multifactorial disease, meaning it arises from a combination of genetic, hormonal, environmental, cellular, immunological, and lifestyle-related factors. Understanding these root causes is critical for both prevention and early detection. 1. Genetic causes. Hereditary factors: BRCA1 and BRCA2 gene mutations. These genes are tumor suppressor genes responsible for repairing damaged DNA. Mutations in BRCA1 or BRCA2 disrupt this repair mechanism, leading to unchecked cell division and tumor development. Women with BRCA1 mutations have up to an 80% lifetime risk of developing breast cancer. Other high-risk genes include TP53, Li-Fraumeni syndrome, PT and Cadden syndrome, CHEK2, PALB2, ATM, etc. These mutations may be inherited and increase the risk significantly. 2. Hormonal factors: the breast tissue is highly sensitive to estrogen and progesterone, which promote cellular growth. Long-term or excessive exposure to these hormones increases the risk of malignant transformation. High-risk hormonal scenarios include early menarche before age 12, late menopause after age 55, nulliparity, never giving birth, or late first pregnancy after age 30. Prolonged use of estrogen-based hormone replacement therapy, HRT. Lack of breastfeeding. 3. Epigenetic and molecular mutations. Cancer may develop from non-inherited sporadic mutations due to environmental or internal triggers. Changes in DNA methylation, histone modification, or microRNA regulation can silence tumor suppressor genes or activate oncogenes. This leads to loss of cell cycle control, failure of apoptosis, programmed cell death, uncontrolled proliferation. 4. Environmental factors. Several environmental exposures are known to increase breast cancer risk. including ionizing radiation, especially during puberty or childhood, toxic chemicals like dioxins, pesticides, phthalates, and polychlorinated biphenyls (PCBs), cigarette smoke, both active and passive. Chronic exposure to light at night may disrupt melatonin and estrogen cycles. 5. Lifestyle-related modifiable risk factors. Alcohol consumption, even moderate use, increases estrogen levels. Obesity and high BMI adipose tissue converts androgens to estrogen. Sedentary lifestyle reduces immune surveillance and hormonal balance. Unhealthy diet high in processed foods, sugar, and low in fiber. Sleep deprivation and chronic stress. 6. Immune system dysfunction. A weakened or dysregulated immune system may fail to detect and destroy abnormal cells before they become malignant. This is particularly relevant in immunosuppressed individuals, for example, transplant patients. Chronic inflammatory states. Reproductive history. Not breastfeeding reduces protective hormonal effects. Assisted reproductive technologies like IVF involve intense hormone stimulation, which may slightly increase risk depending on protocols and age. 8. Age and menopause. Risk increases significantly with age, particularly after age 50. Postmenopausal women are more likely to develop hormone receptor-positive tumors. Conclusion: breast cancer doesn't arise from a single cause, but from the complex interaction of multiple risk factors. The most critical ones include inherited gene mutations like BRCA1/2, long-term exposure to estrogen, environmental carcinogens and radiation, lifestyle choices such as obesity, alcohol use, and inactivity, breast cancer in women, signs, symptoms, and what to watch for. 1. Key clinical signs and symptoms of breast cancer. 1. Lump or mass in the breast. The most common early sign is a firm, painless lump in the breast or underarm axilla. Typically, it is immobile, with irregular borders and not tender. It can be small, even less than 1 centimeter, and still be malignant. 2. Nipple discharge, especially if the discharge is bloody, greenish, yellow, or milky, not related to breastfeeding. Discharge from only one nipple is more concerning. 3. Nipple changes, inversion, retraction, or deviation of the nipple, redness, scaling, or thickening around the nipple area. 4. Skin changes on the breast, dimpling or puckering of the skin, sometimes described as an orange peel. Appearance: pod orange, rashes, ulceration, dark spots, or itchiness. 5. Change in breast shape or size, noticeable asymmetry, one breast looking larger, drooping, or differently positioned. 6. Swollen lymph nodes, hard, painless swelling in the armpit axillary or above the collarbone, which may indicate lymphatic spread. 2. What to pay attention to and follow carefully. A monthly breast self-examination (BSE). Perform once a month, ideally 5 to 10 days after your menstrual cycle starts. When breast tissue is least dense, look for any new lumps, skin changes, nipple discharge, visible asymmetry. Don't forget to check the underarm area as well. The medical screening and exams. Age range recommended screening: 20 to 39. Clinical breast exam every 3 years plus. Self-check monthly. 40 annual mammogram plus physical exam. 50 annual mammogram plus ultrasound or MRI if needed. If there's a family history of breast cancer or BRCA mutation, screening may begin as early as age 30 or even earlier with genetic counseling. See hormone use and HRT, hormone replacement therapy. Postmenopausal women on long-term estrogen therapy should consult an oncologist or gynecologist for risk assessment. The lifestyle and prevention. Maintain healthy body weight, especially after menopause. Exercise regularly. Limit alcohol intake. Eat a balanced diet rich in fiber, vegetables, and omega-3 fatty acids. Avoid smoking and manage stress. 3. When to see a doctor immediately. You should seek immediate medical attention if you notice a lump that persists longer than 2 weeks, any bloody or abnormal nipple discharge, sudden nipple inversion or skin changes, swelling in the underarm or neck area, skin thickening, redness, or ulceration. Diagnosis and treatment of breast cancer in women. Diagnosis of breast cancer. Early detection is critical in successfully treating breast cancer. The diagnostic process includes multiple stages. 1. Medical history and physical examination. Detailed medical history is taken, including personal or family history of cancer, menstrual and reproductive history, use of hormone replacement therapy HRT. Physical exam includes inspection and palpation of the breasts and axillary underarm area for lumps, thickening, pain, dimpling, or nipple discharge. 2. Imaging tests. Mammography. Gold standard for screening women aged 40 and above. Detects small tumors, calcifications, or asymmetries in the breast tissue. Ultrasound sonography. Used in younger women less than 35 years or when mammography is inconclusive. Helps distinguish between solid masses and fluid-filled cysts. MRI magnetic resonance imaging. Recommended in high-risk women, dense breast tissue, or when multiple tumors are suspected. 3. Biopsy tissue sampling. The only definitive way to confirm breast cancer. Types of biopsy. Fine needle aspiration FNA removes fluid or cells using a thin needle. Core needle biopsy removes small tissue cylinders. Excisional biopsy, surgical removal of the entire lump. Immunohistochemistry IHC testing determines tumor biology. PR estrogen, progesterone receptors, hormonal sensitivity. HER2 negative positive. Patient may benefit from targeted therapy. Ki67 marker of tumor cell proliferation. 2. Treatment of breast cancer. Treatment depends on cancer type, stage, size, hormone receptor status, HER2 status, and patient's age and health. 1. Surgery. A lumpectomy, breast-conserving surgery. Removal of the tumor with a margin of healthy tissue, usually followed by radiation therapy. B. Mastectomy. Complete removal of one or both breasts, may include removal of axillary lymph nodes. 2. Radiation therapy. Used after lumpectomy or mastectomy to destroy remaining cancer cells, typically given daily over 5 to 7 weeks. 3. Chemotherapy. Used for aggressive tumors, large tumors, or if cancer has spread. Given in cycles, often combined with other treatments. 4. Targeted therapy. For HER2 positive cancers, medications like trastuzumab, Herceptin, and pertuzumab block HER2 receptors. 5. Hormonal endocrine therapy. For hormone receptor positive cancers, tamoxifen, used in premenopausal women. Aromatase inhibitors, letrozole, anastrozole, for postmenopausal women. 6. Immunotherapy. Used for certain cases like triple-negative breast cancer TNBC. Example, atezolizumab. Conclusion. With early detection and a personalized treatment plan, breast cancer is highly treatable, even curable in early stages. Post-breast cancer complications and psychological impact. A clinically informed overview from a medical perspective. Physical complications. 1. Lymphedema, swelling of the arm or chest. Often occurs when lymph nodes are removed during breast cancer surgery, especially mastectomy. Causes a buildup of lymphatic fluid, leading to swelling, heaviness, and discomfort in the arm or chest. Can become chronic without proper management. 2. Pain and limited arm mobility. Due to nerve damage or scar tissue after surgery, patients may experience numbness, tingling, reduced strength, or shoulder stiffness. 3. Wound healing issues and infections. Post-surgical sites may heal slowly, especially if chemotherapy or radiation was administered. Breast reconstruction increases the risk of surgical site infections. 4. Early menopause symptoms. Hormonal therapies like tamoxifen or aromatase inhibitors can induce menopause-like side effects, hot flashes, vaginal dryness, fatigue, and mood swings. 5. Bone density loss and blood cell abnormalities. Long-term use of hormonal therapy can lead to osteopenia or osteoporosis. Chemotherapy may suppress bone marrow function, causing low white blood cell counts and weakened immunity. 2. Psychological and emotional effects. 1. Depression and anxiety. Many women feel fear, hopelessness, and emotional exhaustion after diagnosis and treatment. Persistent sadness, sleep issues, and irritability are common. Therapy and sometimes medication are essential. 2. Body image issues. After mastectomy or disfiguring surgeries, many patients struggle with loss of femininity, reduced self-esteem, fear of intimacy, and social withdrawal. 3. Fear of recurrent survivor's anxiety. Constant worrying that the cancer might return often leads to hypervigilance, emotional distress, and even PTSD-like symptoms. 3. Supportive care and recovery. Medical rehabilitation. Physical therapy for arm mobility and lymphedema. Regular monitoring of bone health and hormone levels. Nutritional and lifestyle guidance. Psychological support. One-on-one psychotherapy. Participation in support groups for survivors. Family and couples counseling. Healthy lifestyle adjustments. Balanced nutrition. Regular physical activity. Stress management techniques, yoga, meditation. Conclusion. Breast cancer doesn't end with treatment. The journey continues through recovery, healing, and emotional resilience. With the right medical follow-up, emotional support, and self-care, life after breast cancer can be fulfilling and empowered. Breast cancer prevention and post-treatment healthy lifestyle. Prevention of breast cancer primary prevention. 1. Maintain a healthy body weight. Obesity BMI over 30 is a known risk factor for breast cancer, especially after menopause. Maintain a healthy weight through balanced nutrition and regular physical activity. 2. Stay physically active. Aim for at least 150 minutes of moderate exercise per week, such as brisk walking, swimming, or yoga. Physical activity improves immune function and hormone regulation. 3. Limit alcohol consumption. Even small amounts of alcohol may increase breast cancer risk. Avoiding or strictly limiting alcohol is highly recommended. 4. Avoid tobacco products. Smoking increases not only lung cancer risk, but also breast cancer. Secondhand smoke is harmful too. 5. Early childbearing and breastfeeding. Giving birth before age 30 and breastfeeding for at least 6 months have shown to reduce the risk of breast cancer. 6. Use hormone therapy with caution. Long-term use of hormone replacement therapy HRT during menopause, especially combined estrogen-progestin, may increase risk. Should be used only under medical supervision and for the shortest duration possible. 7. Routine screening early detection. Women aged 40 and above should have annual mammograms. Also, monthly breast self-exams are recommended for early detection of any unusual changes. Healthy lifestyle after breast cancer treatment secondary prevention. 1. Regular medical follow-up. Schedule visits every 3 to 6 months with your oncologist or healthcare provider. Regular checkups, blood work, and imaging help detect recurrence early. 2. Emotional and mental health. Post-treatment challenges include anxiety, depression, and PTSD. Seek help from psychologists, therapists, or join support groups to improve mental wellness. 3. Nutritious diet. Focus on a diet rich in protein, fiber, vitamins, and antioxidants. Vegetables, broccoli, spinach, tomatoes, fruits, berries, citrus, legumes, and lean meats. Avoid highly processed foods and excess sugars. 4. Restore physical strength. Work with a rehabilitation physiotherapist to rebuild strength and combat fatigue. Light activities like walking, stretching, and breathing exercises are excellent. 5. Sleep and stress management. Aim for 7 to 8 hours of restful sleep nightly. Practice stress-relieving activities deep breathing, mindfulness, prayer, or meditation. 6. Stay socially connected. Engage with family, friends, and community. Emotional support plays a crucial role in healing and resilience. Conclusion: breast cancer can be prevented and managed. With early detection, healthy living, and proper medical care, women can protect their health and lead fulfilling lives. Life after breast cancer is possible with care, strength, and the right mindset. Recovery can become a new beginning. If you have any questions or thoughts about this topic, please feel free to share them in the comments below. If you found this video helpful, don't forget to show your appreciation by hitting the like button and subscribing to our channel. Take care of your health and stay aware. Until next time, friends, we'll be back with more useful medical information.